Hi, I am Dr. Ravi S.V, Professor in Department of Conservative Dentistry, KMCT Dental College. I am basically from Karnataka, but I have settled in KMCT since 13 years. I finished my BDS from JSS Dental College, Mysore in 2004 and MDS in SDM Dental College, Dharwad in 2010. Soon after my post-graduation, I joined here as a lecturer in KMCT Dental College. Since then, I am working in Department of Conservative Dentistry and Endodontics. Since 2010, I joined KMCT. I see my personal career growth in three horizons: academic, professional, and also in research. Firstly, I joined as an academician, being a senior lecturer in KMCT in 2010. Since then, I have been mentoring undergraduate students in preclinical and in clinics, which gave me a wonderful experience. After that, when KMCT got sanctioned for postgraduate students, I had an opportunity to interact and also become a guide in 2017. Since then, I have been mentoring postgraduate students. I also engage myself in publishing and conducting various studies, and I have 15 notable articles in national and international journals. I have been a peer reviewer for many national and international journals since many years. I see KMCT as a wonderful ecosystem in the horizons of academics, my personal career growth. Now I am talking about an innovative project which I am into, which I am pursuing since some time. That is related to recycling of gypsum waste in dental college. As we can see, this is the amount of various gypsum products which will be thrown into dustbin without doing anything about it. It includes plaster of Paris, dental stone, dye stone, and all the other gypsum products. This is the amount of waste which is produced in a month, and this is happening every month, and we are disposing it and doing a landfill when we discard it without doing any recycling method. My project is to recycle and reuse the same product for dental purpose. In professional growth, since 13 years in KMCT, I had the opportunity of variety of case exposure in KMCT, starting from simple restorative procedure, complex restorative procedure, normal root canal treatment, that is non-surgical root canal treatment, till surgical endodontics, including microendodontics. The amount of cases and variety of cases has improved my skill over 13 years. I see a lot of improvement in my skill, starting from even restorative procedures or in microendodontics. Now, my prime focus is on microendodontics. That includes all the microscopic procedures for root canal treatment till fractured instrument retrieval from the root canal. Research is mostly beneficial when we convert it into a business projects, and that is the new portfolio I have now. I currently hold a position called Nodal Officer at KMCT Incubation Center. We call it KIIC. KIIC stands for KMCT Innovation and Incubation Center. This is a central office for all the IEDCs of KMCT group of institutions. IEDC stands for Innovation, Entrepreneurship, Development Center. This is an initiative from Kerala Startup Mission of Kerala government, wherein this is IEDC is a nodal office of Kerala Startup Mission, that is called IEDC, wherein we conduct lot of activities related to innovation and entrepreneurship development. This is open to all the students and faculty, whether it is teaching or non-teaching faculty, that is all the KMCT fraternity. We engage them in developing their innovative ideas into a business products and encourage them to become entrepreneurs. We conduct lot of activities and help them to develop their ideas starting from ideation stage, and guide them and mentor them and develop them to have a contacts and networking. We also help them to get the contacts to fab labs nearby and also help them to get grants and funds, and finally get them the guidance for registration of their company if they want to start a startup company. Our future plans is to become a full-fledged incubator, maybe a TBI and a full-fledged incubator where we can support better for our students and faculty. Now I am talking about one of my innovations which has won a grant amount from MG University in collaboration with Kerala Startup Mission. This project was about recycling of gypsum products, which is a waste product discarded in dental colleges especially. We can see the amount of gypsum products including plaster of Paris, dental stone and dye stone. After the use in our labs, we just discard them and landfill them, which is also environmental hazard and a recurring cost is for the dental college or dental practitioners if at all we don't recycle them and reuse them. So my innovation was about how can we recycle these waste products and reuse them, and this innovation has proven that we can recycle n number of times and we can reuse them n number of times if at all we do a proper treatment. And this is a design concept of my product wherein we can simply put this waste product into this grinder. It will all get grinded and get processed and get heated, and we can collect the waste product as a powder, and that powder can be taken back and reuse them how many ever number of times. Okay, so now this project is also completing by end of July, and I will be soon starting my own startup company supplying these machines to recycle whoever want to do the recycling of gypsum products, mainly for dentistry. And also our company would plan to scale up to gypsum wall manufacturers or any gypsum companies who want to do the recycling. After winning the project, that is research incubation program, we got inspired, and my postgraduate student, we told that we can apply for one more innovations which can avail the grant. So we applied for research incubation program for women entrepreneurs, and she also won the grant for women entrepreneurs, wherein we are planning to do the recycling of discarded root canal files. So that project is yet to start, but we have won and received the grant already.